Hello, I'm Nora Duncan, State Director for AARP Connecticut. Welcome to the latest installment of Coffee and Tea with AARP Connecticut, where we chat with policymakers and influencers on issues important to people 50 plus and their families. Today we have with us House Majority Leader Jason Rojas, who represents the 9th Assembly District, which includes East Hartford and Manchester. Welcome back to the program. The last time we had you here was for a preview of the 2021 legislative session, and now we've just kicked off the 2023 legislative session. So, you're the House Majority Leader. What does that entail? And what are some of the issues that you deal with in this role? And maybe a couple of the most important things that you think will happen in 2023 that are important to older residents?
No, well, thanks for having me on, Nora. Happy New Year. It's good to be back in a legislative session. We know the session has just kicked off. There's going to be lots of proposed bills that are working their way through the system. So some of the answers to your questions we'll know in a couple weeks, knowing that it takes a while for the bills to make their way through the early part of the process. But I'm sure we'll have lots of debates on lots of issues that impact members of AARP and those who are of age to be a member of AARP but may not be an actual member. As Majority Leader, it's my job to work with the Speaker to kind of manage the legislative process. So myself, our team, as well as a team of deputies, our work really begins, I'd say, in March. The way the session breaks down, the early part of the session, members primarily spend all of their time actually in committee, debating legislation, having public hearings, taking final action. And it's when committees take final action on legislation that the work of the Majority Leader and his team really begins. And prior to all that, I spent a lot of time in meetings with folks who come in and are for a particular piece of legislation or a particular idea. And I meet with plenty of folks who come in who are against a particular piece of legislation and want to see something either happen with it, go away permanently, or make changes to it. But once all the committees report all of their work out, our team gets together, and on a weekly basis, we will review all of that legislation to determine exactly what is going to be a priority for us. Is it a priority for us this legislative session? Does the bill have a certain cost to it? If it does, it'll need to go to the Appropriations Committee. Or if it's a bill that has a component that is of the cognizance of another committee, it'll have to go to that committee for review as well, in the hopes that committee will look favorably upon it, report it, and then it comes back to us. And once we go through that process, we're talking about a couple hundred bills by the time we get through all of the weeks of reviewing legislation. And then our Republican colleagues have a similar process on their side where they review that same legislation. And then we actually get together and make determinations about what other committees a particular bill is going to go through. After we get through that, obviously bills make their way to the floor of the House for final action. Again, the Majority Leader team is responsible for managing the day-to-day operations of session when we're in the House chamber taking final action. So determining the agenda for each day, working with our colleagues on the other side of the aisle to manage the day itself, to see where there is agreement, to understand where there are disagreements, and try to manage how much time we spend on a particular session day on a bill or how long the day is going to be. But it's really kind of managing the legislative process is the global way to look at the Majority Leader's job.
And that managing the calendar at the end of session is one of the things that stresses out people like me on the other side.
That's right. I will hear from advocates and lobbyists and activists and even members of the governor's state agencies who all believe their bill is the most important one. Therefore, it should go today. I will have very nice conversations with everybody and not overpromise.
Yep, that is exactly how I would describe it. Right. So a lot of our priorities at AARP Connecticut are really pocketbook issues. And, pocketbook means a lot of things, but when I say it, it means preventing financial exploitation, prescription drug affordability, fair and affordable utilities, and keeping more of your hard-earned retirement income in your own pocket. So I'd love to talk about some of these issues with you and just, get some early session feel for it. Given how you've explained the session, I think we all know many, many caveats that can happen between now and early June. But, what are your thoughts on controlling the cost of electricity, for instance? We have a standard electric service offer by United Illuminating and Eversource, which doubled on January 1st. And there's a rate case before Pura for United Illuminating for another, I think it's 15% increase over 3 years. So what are the kind of things you're hearing about that can be done to maybe control costs?
Yeah, I mean, what we're most hearing, I think, is frustration, right? I mean, I think these types of issues, pocketbook issues, are something that members of AARP were sensitive to prior to this kind of economically uncertain time that we're currently operating in. You add in inflation, you add in supply chain issues, you add in global issues like the war in Ukraine, which all have impacts on how issues around electricity costs impact people day to day here in Connecticut. And it's often it's the most complicated policy issues that we deal with at the legislature. So I'd say if there was an easy answer, we would have solved it already, which is really complicated. And I think there's also a number of conflicting tensions that drive our ability to actually come up with solutions to this. Because, right now we're existing in this world where, we've always powered, either through gas or through oil or through the traditional kind of natural resources that we've used to power our economy and power our state and power our homes. And we're slowly moving away from that, right? Investing more in solar, investing more in wind energy, trying to provide more access to solar on people's homes. And that comes at a cost too, because when you introduce a new option to a marketplace, it's often going to be very expensive at the forefront. And we're beginning to see the prices of all the benefits of moving in that direction happen, but certainly they're not as in the marketplace that would allow it to drive down the cost. But we're working on that. So what I think what we're seeing already is, you mentioned PURA with a rate case. How can we empower PURA to be stronger in their regulation of how they regulate Eversource and UI? And as everybody knows, there is some competition in the marketplace, but not really, right? We have these two providers who primarily provide energy here in Connecticut, but individuals have the option to look at other providers and check that off if they have the wherewithal to actually investigate the options that are out there, if they have the time to do that and actually understand it, because it can be a complicated process. But how can we empower PURA to have a stronger oversight and stronger involvement in terms of controlling costs, ensuring that the current providers are being as transparent in terms of their costs, because as we're seeing with this increase that everybody is painfully aware of, Eversource and UI have largely explained they're just simply passing the cost of energy, right, of the energy that they use to create electricity. They're just passing that cost along. And as we all know, price of gas, price of oil has been very high of late. We're starting to see gas come down at the pump, which is a whole different energy issue, but very much aligned with this one. And I think there's a lot we all need to understand exactly what's going into the business model for Eversource and UI, that they're able to pass along costs like this when we all know they're also experiencing record profits. So it's a bit of mixed messaging in terms of we're just passing on along costs, yet we're realizing there's record profits, something's missing there. And we could all go back to the late 90s when we deregulated the system and thought that was going to be the solution to this. What that left us with really a monopoly on energy, on the ability of companies to provide energy in Connecticut. And that's often come at the expense, obviously, of consumers.
Yes, it is complicated. And I would just take this minute to refer AARP members and non-members alike to the January issue of the AARP Bulletin. The Connecticut article is about energy and the kind of programs that are out there and available for people who may not be able to meet the high cost of energy this heating season. There's more out there for you at income levels that might surprise you. Don't start cutting up your pills to put heat in the tank without checking this stuff out first at aarp.org/CT. And we've got a lot of great help in this state. And with luck, perhaps, Representative Rojas, more is on the way.
Yeah, but that education piece is really so important because, it's amazing to hear. We are all aware of the programs that exist to support people, but it's really hard, I think, for the average consumer, average taxpayer to be fully informed about what options are out there for them. So the education piece, I think, is really important as well.
And I think people just have never had to take advantage because they never needed it until this sort of perfect storm that we're having now. So just read up. If you're not going to be able to help yourself, maybe you can help a friend or a neighbor or a loved one. All right, let's move to the next big pocketbook issue, which is a thorn in my side every legislative session. But we've had some relief in Connecticut. But, that was around insulin a couple of years ago. Really glad that we were able to cap costs on insulin. The same is going to happen in Medicare moving forward. But really not a lot of relief in terms of the cost of prescription drugs in Connecticut. Medications don't work if you can't afford to take them. So while we want to fight at the federal level in 2022, what can we look forward to seeing at the state level?
Yeah, I mean, I think this is another one where there's an opportunity to partner or to look at the way the federal government handles this, whether it's negotiating power, using the negotiating power of the state of Connecticut to work with companies to lower rates. I think there's an opportunity maybe to work with other New England states and approach this on a more regional basis to increase that buying power and that leverage power that we might have to negotiate. Obviously, the state of Connecticut purchases a lot of prescription drugs too, whether it's for employees, for the correction system. How can we use those models to benefit the broader public in terms of being able to access prescription drugs? I think there's some greater utilization review, right? Looking at the type of drugs that are being used or the type of drugs that are being prescribed to individuals and trying to determine whether there are more generic versions of that that perhaps won't, result in some kind of complication or an allergy to something that's in a generic drug. But looking at the generics as a way to try to help save costs for individuals as well.
Great, thank you. That is a complicated topic. You are not wrong. I think a less complicated topic when it comes to understanding it is about last year's legislation that basically sped up implementation of an existing law that eliminated income tax on pensions and annuities for retirees up to a certain income level. That income level being $75,000 a year for an individual and $100,000 for a couple. But if you made $75,001, you got no benefit at all. You paid full taxes. So we call that a fiscal cliff. AARP is not a fan of the fiscal cliff. And I know there's been some buzz around different proposals to maybe eliminate that cliff or raise income limits. So what can we expect?
Yeah, I mean, I think this is going to be a popular issue, right? I mean, anytime we have an opportunity to reduce the tax liability on a taxpayer, I think it's generally good policy, but obviously very good politics as well. And I think it makes this one of those easy ones. I can tell you, because I chaired the finance committee when this conversation began on phasing out the tax on retirement income. And there are some individuals who think, if you're making $100,000 a year in retirement, you're doing all right. And so that, just so people understand the political complexity of this within a complex organization like ours, where you have people from across the political spectrum who are making these arguments, and there are others who are like, but these are retired, right? Why should they pay tax on retirement income when they worked their whole life and paid income tax then? So naturally, we're going to see these. The cliff effect is a difficult one both ways. We see these in a number of areas, the cliff effect, and also when you're accessing certain benefits, if you make too much money, and it results in an incentive for somebody to not work as much so they don't hit that cliff and then use a public benefit that is really meaningful to them, whether it's health insurance, whether it's access to food stamps or support for buying food. And I think, part of the cliff effect too is when you get into the ranges, it adds a level of complexity to the overall program that then has to be administered by the Department of Revenue Services, which results in additional costs to the state. We'll have to have additional personnel, I think, support to manage that. If they're, depending on how you structure it after that, it would be a range, much like we see on the traditional income tax. But it's going to be a popular issue. And I think it becomes a matter of what's the impact on the budget? What is the revenue loss going to be? Because that's often what it comes down to when we're considering legislation. If it costs too much money, it causes a problem. If it loses revenue, it causes a problem. And I think most people would say, well, you have a rainy day fund and you have a surplus. And yes, but we have to think beyond the next year or two and really think about the long term and ensure that something like this is sustainable so that some future legislature doesn't have to rescind it.
Thank you. All right, so this next topic is one we've talked a lot about in the last few years, but there have been a lot of changes to the laws surrounding nursing homes.
Right.
A lot of them as a result of the pandemic, which makes tons of sense, right? But compliance with those laws, even those passed before the pandemic, has not often been stellar. And I'm talking about staffing levels, about minimum hours of care, about transparency issues. And I will say I'm very aware that there's staffing concerns and shortages in the healthcare field in general and in nursing homes. But that's not going to make AARP stop saying that nursing home residents deserve the highest quality of care, and taxpayers who are paying for most of this deserve the accountability that the law says they need to have. Especially now because private equity investment in nursing homes is seriously on the rise. So when they come to the General Assembly for more money,
Yeah.
there's some concern there because private equity usually equals profit margins. So it's not an easy topic, but it is one that your caucus, your chamber is probably revisiting in some way, shape, or form.
Yeah, I mean, nursing homes, right? I mean, they are often a necessity that I think we want to see as a last resort. In my time in the legislature, we've certainly been moving towards supporting people in the home and providing a level of care for them in their home. We know that's what's best for their health. It's what's best for their mental health, and being able to stay in their home, right, in the home that they raised their family in. But we also know that there are some individuals whose needs exceed the ability to provide care at home, and they have to end up in a nursing home. And we also know it's the most expensive care to provide. We also know, and I struggle too with this whole, I hear from nursing home operators all the time how they're operating on thin margins, and it's, it's not profitable, or they're not making their money. And then I'm like, why are you still in the business then, right? I mean, there's something still keeping you in the business, add in a component of private equity, and I think it makes that argument even less so. But there's no doubt that the services that they are providing are the most costly. We know that a lot of our healthcare spending is spent on the later years in life when people develop chronic illnesses or serious illnesses. And, for a lot of the individuals in nursing homes, it might be that they don't have family that lives around here. So it becomes really difficult, right? So I've had constituent issues where they want us to find nursing homes, and some of the fines that are currently in place are very excessive, right? A couple $1,000s for an infraction, which seems really low when you place it in the context of the offense that's occurred. But at the same time, if you're going to fine them, that money is also coming from resources that they would actually otherwise use for care, right? Or resources that they would otherwise invest in personnel. So trying to find the right balance between holding nursing homes accountable for the service that they provide and ensuring that they're providing high quality services, but also not providing the resources that we should be providing to either a nonprofit or a privately owned for-profit nursing home. The state is providing them services, but we're usually, especially through Medicaid, reimbursing them for not a dollar for dollar reimbursement, right? It's 75 cents on a dollar, 80 cents on a dollar, and that differential has to be made up somewhere, and it's usually made up with private insurance holders. It's how they make their money. But as we see the need continue to grow in the community of access to healthcare in general for individuals who are not elderly, but in particular for individuals who are elderly, it's a difficult balance that we're trying to to contend with. So I understand the desire for minimum staffing type of laws, right? We want to provide the best care to these individuals, but then coupled with that is ensuring that we pay these people adequately. And a lot of the jobs in the healthcare field are underpaid, particularly the CNAs and the personal care assistants who are doing the most difficult work, make the least of the people who work in that industry. And as you know, over the last couple of years with COVID, we've seen just enormous burnout in that community. There are healthcare shortages everywhere. So we're definitely going to have to take a balanced approach to this. One, we have a responsibility to ensure that the best care is being provided to our most vulnerable neighbors. But we also, if we're going to do that, we're going to have to put our money where our mouth is and ensure that we're able to invest the adequate resources to do that.
Yeah, a couple of things that you said brought other thoughts to mind. So one is that there's a home care task force that has been operating over the last few months, and they have some recommendations coming out about the home care industry, about regulating that, about making it better, more understandable, more fruitful for those people that we do want to keep at home and who want to be at home, less expensive, safer, happier, the list goes on, right? Good for everybody to be able to age in place with some assistance if you need it, maintain your independence the best you can. So I hope the General Assembly will be looking at that very closely because people worked really hard on it. Right. And then I would say for those folks who do have loved ones in nursing homes, just be aware if you have concerns. The General Assembly finally did pass a few years ago a bill that allows for two-way communication right in the nursing home room, completely the right to have a camera, a Ring kind of situation, anything you can buy off the shelf so you can pop in on your loved one at any time. But like you said, people oftentimes don't have family around. And even if you are around, 24 hours is a long time in a day. You might not be able to get there. You want to see what's going on. And if something isn't right, you now have the proof and can follow up on that. So taking advantage of those laws that we passed to help people who are in nursing homes and their loved ones is really important. And I don't think we probably talk about those laws enough.
Yeah, we also know to look at the role of family members in providing care for a loved one.
Yeah.
We know primarily, and this is the burden primarily falls on women, I believe, or at least that's what I've seen in my personal life, right? But if there are family members caring for a family member, is there a way to compensate them, right? I mean, obviously they have to be trained. There are different levels of support that are needed. Sometimes it's for basic type of functions, getting dressed, brushing hair, bathing, doing shopping, and not so much the direct care. But is there a way to really either through respite programs or directly paying individuals, right? I mean, I think there are a lot of people who have left the workforce because they're caring for a loved one or an elderly loved one. And we know we're kind of in this demographic bubble right now where a lot of baby boomers are retiring, and we're only going to see that community grow even more. And we have to think about the best ways to use the limited resources that we have to make the most impact. And obviously leveraging the ability of family members to provide that care or provide them respite support is something we should be looking at as well.
I'll go with an amen to that. For that one. All right, we're almost out of time. So I thought maybe this would be a good time for you to wrap us up with some insights as to, what it looks like in the building in the kind of post-pandemic world, but with still a lot going on in terms of viruses, for the public in the legislative office building when public hearings get going. And, whether it's in person or not, how do people get involved with the issues that they find important?
Yeah, I mean, I think this is another area where education is important because I find most people still don't really understand how the legislature works or how accessible we actually all are as legislator, right? First, we're your neighbor. We all live in a community across Connecticut, and we can often be found locally doing local office hours or town halls, or even at the grocery store. I've been stopped plenty of times with, hey, I got a question for you type of thing, even mowing my lawn a couple of times. But, the building has been open for some time now. I think you will see more legislators here in the building in person. We're likely to still continue to have, and the rules are still being negotiated among all the caucuses, but we can expect to continue to have virtual public hearings because we found that actually made it easier for the average person to participate in the public hearing process. And the public hearing process is really an opportunity for anybody to come in and tell us why they're for something or they're why or against it, or whether we should just make a change, right? That they're open to a concept that we're debating, but they think that a change should be made. You can do that and come to, and I think some of the committees will probably do hybrid type of hearings. Will there be some physical presence of members of the committee here in the building in the hearing rooms that we have? And then there'll be a virtual component too. And I think that's really, that's part of the process where you can really educate legislators, where all the people who are impacted by the legislation, we're debating whether you're an average taxpayer or a business owner, or an advocate or an activist, where you can impart your wisdom on us so that we can think differently about the legislation that's before us, that we may have had a preordained idea about how we felt about it. I've always been fascinated where I think, I'm looking at a bill, it's obvious I should support it, and then somebody comes in and educates me on it, and then I have to reconsider my position on things. That's a really great opportunity for one, the public to participate, but two, for us as lawmakers, citizen legislators, right? We're not professional politicians. I think the way people like to frame us, it's an opportunity for us to learn a little bit more. But I think you're going to see a lot more, the building's going to be a lot more lively than it has been for the last 3 sessions. I think, or 2 sessions, 3, I don't remember anymore. 2021, yeah, 2. So felt like 5.
I mean, I think we're looking forward. I know my army of red shirts, as we like to call our advocacy volunteers, are psyched and ready to come back. But at the same time, I mean, somebody's going to get sick, but not sick enough that they can't testify virtually. You talk about, right, like nursing home residents, they need to have the ability to testify, and being able to do it virtually versus having to get transportation care while you're there. I mean, it lets the people that you're talking about have their own voice at the table. Caregivers, I can't leave mom for 6 hours to come sit in your committee room and wait my magical turn by lottery, right? I can't do it anymore. So I think it's great that one of the, as my state president, volunteer Tia Murphy says, the tarnished silver lining of the pandemic, right, is that we're finally going to modernize how we do things at the Capitol when it comes to involvement of the public. So that's fantastic. It's going to be a long one. I look forward to working with you.
Yeah, it's going to be interesting for sure. You know, we know that it's a state budget year when we pass a 2-year budget. That is always a very big debate. And we're in a place right now with our finances where we're feeling healthy, but still have a lot of long-term debts that are out there that we can't forget about or take our eye off of, because, you know, it was just 5-6 years ago, right, where nobody would have thought we would have had the surpluses that we are having right now. And I mean, for all my first, 14 years in the legislature, it's been one of fiscal crisis. And it's interesting to be in a place where we actually have some resources that we really need to invest wisely and strategically so that we can see some long-term benefits to what might be, a temporary being in the black type of budget situation.
Nothing like having money to fight about, or
That's
no,
right.
Better than having no money to fight about.
That's correct. That's
I'll go with that.
Yep.
All right. Well, with that, Representative Jason Rojas, he is our majority leader in the House of Representatives in Connecticut. Thank you for your insights, for your time, and for your work on behalf of the people of your districts and Connecticut.
No, thanks for having me, and thanks for the opportunity for your members and anybody who might be watching this video learn a little bit more about the process.
See you at the LOB soon.
See you soon.